Few things are as universally dreaded as kidney stones. They are the solid, painful minerals that can bring even the toughest among us to a standstill. Every year, millions experience this intense discomfort. But what actually causes these infamous stones to form? To understand kidney stones, we have to start with the remarkable job the kidneys perform. These small, fist-sized organs filter about 120 to 150 quarts of blood each day, removing waste and balancing the body's fluids. They are internal purifiers, quietly ensuring that the chemical composition of our blood remains precisely tuned. But sometimes, their meticulous filtration can go awry, and that's where kidney stones come in. At their core, kidney stones are simply hard deposits made of minerals and salts. Under normal circumstances, substances like calcium, oxalate, and uric acid, common byproducts of metabolism, dissolve in urine and exit the body without causing any trouble. But if the urine becomes too concentrated, or the balance of these substances is off, they can begin to crystallize. Over time, these tiny crystals attract more dissolved substances, growing larger until they form a stone. The most common type of kidney stone is the calcium oxalate stone. In about 80% of cases, the stones are made of this compound. Ironically, it's not entirely a matter of calcium intake. Rather, it's the complex dance between calcium and oxalate in the body. Certain foods, spinach, rhubarb, nuts, and chocolate, to name a few, are rich in oxalate, and when consumed in excess, or when combined with dehydration, they tip the balance in favor of stone formation. Dehydration is perhaps the most straightforward risk factor. The kidneys rely on a steady stream of water to dilute the substances in urine. When someone doesn't drink enough fluids, particularly water, the urine becomes more concentrated, increasing the odds that minerals will crystallize out. It's no coincidence that kidney stone rates spike in hotter climates or among people whose lifestyles don't prioritize hydration. But there's more to the story than just what we drink or eat. Our personal genetics play a significant role. Some people naturally excrete higher levels of substances that encourage stone formation. Family history is a strong predictor. If a parent or sibling develops stones, the risk rises significantly. Other types of kidney stones are less common, but each has its own causes. Uric acid stones, for example, often develop in people who eat high-protein diets, particularly diets rich in red meat, shellfish, and organ meats. These foods lead to increased production of uric acid, and if the urine becomes too acidic, uric acid can crystallize instead of dissolving. Then there are struvite stones, which are typically linked to repeated urinary tract infections. Certain bacteria can convert urea in urine into ammonia, raising the urine pH and facilitating the formation of these large, often fast-growing stones. These are more frequent in individuals who have chronic issues with urinary tract infections. Might occur with some structural abnormalities or extended catheter use. Some stones form not because of what's consumed, but because of underlying medical conditions. Cystine stones, for instance, are a rare hereditary disorder that affects how the kidneys handle certain amino acids. People with inflammatory bowel disease, gout, or certain metabolic conditions may also have an altered risk due to how their bodies process certain substances. Medications can also play a surprisingly large role. Some diuretics, calcium-based and even certain anti-seizure drugs can promote stones, either by altering urine composition or by increasing the amount of stone-forming substances in the urine. Interestingly, for all the focus on what causes kidney stones, the story is fundamentally one of balance. The body produces substances like citrate and magnesium that naturally inhibit stone formation, keeping crystals dissolved by binding with them before they can coalesce. But when the balance tips, whether because of diet, dehydration, genetics, or underlying conditions, the inhibitors are overwhelmed and stones start to form. Prevention, then, is largely about maintaining that internal equilibrium, drinking plenty of fluids, moderating intake of stone-promoting foods, and addressing pre-existing health conditions can make a profound difference. For those who are genetically predisposed, working closely with healthcare professionals is especially important, since even minor shifts in diet or medication can change the risk environment. Ultimately, kidney stones stand as a reminder of the delicate balance inside our bodies, and how something as simple as a missing glass of water or a modest change in diet can set off a cascade resulting in days or weeks of discomfort. By understanding their causes, we unlock not just avenues for prevention and treatment, but a deeper appreciation for the everyday work our kidneys do quietly, efficiently, and almost always behind the scenes.